So hello everybody, welcome to our webinar. I'm Serena and today's webinar is going to be a re-recording of the live event we did, which was so popular. So we've re-recorded it so everyone can dip in and out and watch and get the key take-home points. So essentially it's a CCT masterclass on work, getting work, negotiating your contracts and getting paid. So hopefully it's going to help you get really prepared for going forward. So it's presented by myself. I'm Dr. Serena and my friend and colleague, Craig. Craig, say hello.
Hello, thanks for having me. Hello, everyone.
And so a bit about what we're going to cover today. So this is one of three kind of masterclasses we're going to put together for you guys. So today we're going to talk about how to find work for your roles post-CCT, how to write a compelling CV, a bit about interview skills, negotiating contracts. If you're going to locum and you're going to work directly for practices, a bit about how you set your T's and C's for work, a bit about pay rates. And with our live webinars, we do a live Q&A, but you can send us questions and we can, happily answer them for you if there's particular things you want us to cover after watching today's recording. So a bit about me. So I am just coming out of my first 5 as a GP, and kind of when I got to the end of my GP training, I really wanted to create quite a varied career. So kind of fast forward 5 years on, and this is essentially my CV. I co-founded a popular software called My Locum Manager, or MLM as it's known, and it supports locum salaried partners, portfolio GPs, to manage all the administration, connect with local practices, get lots of support. So basically kind of a complete support package as well as the technology to help them get started. And I set that up because I kind of needed that myself as a locum GP. I also present for Red Whale. I'm Macmillan GP for my area and I write for Pulse. And as an ST2, I was involved in medical school teaching, which I did through Imperial College. And when I finished my GP training, I did it through King's College. So any of you guys can kind of access that by contacting them. Right, Craig, over to you.
Yeah. So, hi everyone. I'm now a sessional GP in North London, in Islington. I'm also a clinical director for the North Islington Primary Care Network, and I sit on the board of the Islington GP Federation. These are some of the pictures, I suppose, that reflect a kind of life recently. Generally looking confused in masks, process mapping things on walls and drawing on walls, and being in lots of Teams meetings. And then I've thrown in a picture of Stella, my Welsh Terrier, who takes up the other part of my time and helps to balance me out a bit. I suppose I'm here. I was a partner for 4 years at a large GP practice in Islington, and I guess that's why I'm here. I suppose I had experience with employment, with looking at CVs, with thinking about contracts. So I don't come as an HR expert, but I do come with some practical skills and practical tips, which hopefully you guys will be able to benefit from and use this as a resource.
Great. Thank you, Craig. Thanks for joining me today. So as I said, if you get any questions, we normally do a live Q&A on all our webinars. And if you have any particular questions, you can get in touch at the end and we're happy to help you out. Okay, so first thing, in order to prepare for work and get ready for the working world as a GP, this is a list of all the documents you're going to need to get into place. You're going to need an up-to-date CV. Your CCT, GMC certificate and performers list inclusion will happen when you're signed off your ePortfolio. You may need to arrange a certificate of indemnity cover. Now, all of us as GPs are covered by state-backed indemnity or Crown indemnity. However, if you're going to be locuming or doing salaried work, or you're a partner and any of your roles are deemed to be non-NHS related, you may not be covered. So this might include work such as in your day-to-day GP practice, you might be doing taxi medicals, signing letters for marathon runners. You might have a professional allegation against you, which has nothing to do with your clinical capacity, but is more against your kind of manner or the way a patient interpreted you to be. You might have GMC referrals. So all these types of things are not covered under the state-backed indemnity. So all of us generally will call one of the 3 providers, or all the 3 providers, and get a quote to cover us for work going forward. So for you guys, for example, if you're going to do some 4 sessions of salaried and locum work, you would call the 3 providers, tell them that, or say, yep, I'm just going to locum, or I'm going to be a partner and do X, Y, and Z, and they will give you a quote, and then you pay for that additional cover. And that should give you comprehensive protection kind of going forwards for your career. You'll also need a valid DBS check, an up-to-date immunisation record, 2 references, and a copy of your passport for proof of eligibility to work in the UK. Now, a bit about the CV side of things. So we're going to delve into that in slightly more detail. Now, if you would like a template to put a CV together, you can actually download one for free on the My Locum Manager resources section. So that's on mylocumManager.com/resources. And you can just input in that what you need to get a CV together very quickly. But what I wanted Craig's input on actually was what makes a good CV. So this template that you're seeing now is an example of the MLM template, and it starts with career aspirations. And my own CV is from this template, and I start my CV with career aspirations. And now when I look back, I kind of dotted out over the next few years post CCT what I wanted to achieve and what I was hoping to achieve in my career. And now when I look back at that original version 1, I'm like, oh wow, I did do that. And then I kind of update it and I create new aspirations. So as a locum GP, for example, mine was I wanted to expand my interest in education. I wanted to build some continuity and relationships with local practices. And I was really interested in cancer strategy. So that was my career aspirations, what I wanted to develop. But I think there's definitely a knack to kind of the way you present your CV. So Craig, I'm going to hand over to you here to talk us through kind of what you look for and tips for certain things that you need to fill in over the next 2 slides.
Sure. So I think it's really worth remembering what a CV is for. And actually, reality, the CV is to get you an interview. It's to get you through that initial process in order to tick a few boxes and then get you to interview. So I think it's worth really bearing that in mind when writing your interview, because actually you will get an opportunity to talk about things that you want to talk about. But this is prime real estate. Your CV needs to be short. It may not even be read by a clinician. It may be read and ticked off against by an administrator who's looking against a person's specification. So your CV needs to get to the point. It also needs to have things on it that are essential to have, such as evidence of your qualifications, your educational background, maybe some of the skills and other things that form part of your qualifications, and your work experience. But it also needs to have some things which will help you to stand out and tell people a little bit about you, and also about what your experience is, where it's relevant. And bear in mind also that you're applying for different roles in different circumstances. So applying for an academic role, for example, probably requires a slightly different rejig of your CV and a different presentation of information, a different depth of information than, for example, a CV if you're applying for a salary GP role. And it should probably be different again from if you're applying from a locum role, where probably an emphasis more on your experience and your clinical and non-clinical skills is probably more important. Whereas something which involves a longer term process, such as a salary GP role, where it might be more about personal development or how you fit into the ethos of the place, you may need to present your information in slightly different ways.
So one question came up when we did this live, Craig, which I thought you answered really well, was how much information and detail do you need to go back? So for example, for your professional activities or all the work you've done, say for example you've done many years in hospital medicine, then changed to general practice, or you've done another career before general practice, so you could actually have 4 pages listing everything. What do you think, with your employer's hat on, like how much you actually need to list here and how far back you need to go?
So there's some information on your CV that will always need to be there, such as your university that you went to, when you got your MBBS, or MBCHB, whatever it was that you had. And it also is worth, I suppose, you do need to list your employment history. I suppose the things which, if I'm a GP partner and I'm looking to employ a GP, I'm probably most interested in the bits that directly relate to general practice. So, for example, if you've done GP placements as an F2 or as an ST3 or as an other ST, it's really helpful for me if you not just to write that happened and that was you're in a practice, but actually I may not know anything about that practice. You should assume I don't know anything about that practice. So what was the practice like? Was it a big practice, a small practice, in a city? Were you doing 10-minute appointments? Were you doing duty doctor? Do you have skills were you doing telephone triage? It's really helpful to understand so that I can put that into some kind of context. Whereas actually, because also if you just write the place, I don't know anything about that, and it helps to work out if you might be a good fit for my organisation or not. But also, if you list, listing and telling me about your, I don't know, your surgery placement as an F1 that might have been, 5 or 10 years ago, that, you list it, put it there, but keep it small, keep it brief, unless it's got some real relevance to something that you want to do, such as you learned surgical skills there and you're actually a minor surgeon now, for example. But
Yeah,
just it's worth thinking about what it adds to you.
Yeah, so you can summarize, like, for your professional activities. You don't need to list, as an F1 I did this many weeks of this, this and this. You could just literally put, surgery, and in brackets what that was, medicine in brackets what that was, if that's relevant, and you could put previous career as an accountant or whatever it was. And they can ask you about that as well, because this is very much a doorway in, and then obviously you'll cover more kind of going forward. So this second part is really interesting, and we had a good chat about this on the live webinar. So it's really important to put things like your presentations and audits down, and this one purposefully is probably not the best way to do it. So here you've got correct coding of diabetes audit and where you did it. Why would this be important? Well, it would be really important if you did that audit because you're in an area where the population health is very poor because it's kind of rampant with diabetes, and you did the audit because you noticed that at the practice there was scope for improving diabetic outcomes, for example. I think, Craig, you had some important tips here as well, didn't you, about what, like, when you're putting down kind of the other activities that you've done, like your presentations and audits?
Yeah, I think it's probably not just enough just to list them, because also different things mean different things to different people. And we've all been involved in various audits at various points in our lives and thought, well, we didn't learn much out of that. I think it's important for things to go in your CV that demonstrate transferable skills. So because while the audit may or may not be directly relevant, and if it is directly relevant to the job you're applying to, well, great, then absolutely, make sure that's made obvious. But actually, a lot of the things that we do, including sort of extracurricular activities, can demonstrate leadership skills, teaching, education, being involved in sort of system design. These are skills that are really interesting, or maybe really interesting or relevant to a future employer. So just highlight, I think, if you've learned something transferable from it that you did, because just listing it isn't going to be enough. And people reading these CVs will have different levels of wanting, then they don't want to work that hard. They may have 30 CVs to get through and actually maybe only shortlisting to 5. So you want to make sure that you stand out by showing that you've got skills.
Yeah, and definitely make sure you use the opportunity when you put your CV together to show what really interests you and what your passions are and where you want to take that forward in general practice. So a common question we always get is, how long should a CV be? And I think kind of we were saying like 2 to 3 pages is great. Sending in a book is not a good idea. And then the last part on here about the personal achievements and interests. So one thing that Craig and I always talk about is kind of the culture that you bring to a practice. So I have only ever locumed, actually. I've never done a salaried role or partnership, but I am still very much part of the practice team because that's how I choose to work, and that's the kind of relationships that I want. So for example, in some of the practices where I work, they do a summer bake-off. So, everyone will bake and bring something in, etc. And I actually I enjoy eating cake more than I enjoy baking it, but I do enjoy baking, so that could be part of your professional interest. One of my friends who's a salaried GP loves running and doing half marathons and 10k runs and marathons, and she set up and she put that in her professional interest and personal interest, and she set up a running club at her practice. At my husband's practice, they do kind of fish and chips Friday, and they do morning coffees and things like that. So they've got a real social element. So I think in this personal achievements and interests, it's really important to show kind of what you're about and also what you might want to bring to a practice team.
Yeah, I think that's right. We had a question on the live webinar about, to what extent should you list hobbies? And, I guess the stereotypical thing people write is, I like hanging out with my friends and, going to the pub. And you're like, well, that's nice. I suppose it is worth some extracurricular activity, some personal things actually add a dimension to you and can make you interesting, but also can demonstrate skills. So some people, you don't have to be a scout leader or something in a formal way, but actually, as you say, it helps to bring in your ethos or other things that you may have done, or things that skills that could be transferable in. So it's just part of reflecting who you are.
Yeah.
But also trying not to, I suppose, reflect negatively on who you are as well. And if you list a bazillion things that you really like to do outside of work, an employer might question whether or not actually you really want to be at work. But so I suppose just make sure it doesn't backfire, but utilize it. It's, as I say, it's prime real estate. Utilize it as an opportunity to show off.
Yeah.
And you mentioned earlier on, for example, Serena, also about, some people may have had other careers in the past, such as accountancy or something else. And actually, if that shows skills also, then bring it in a bit, why not?
Sounds good. Okay, cool. Okay, so a little bit about recruitment. So a lot of trainees were, worried, like, oh, will I get a job? What's happening with salaried and locum recruitment? And I just wanted to share a couple of things off the back of a survey that I did. So on My Locum Manager, we have about 7,000 practices, probably a bit more than that actually, that all work directly with the GPs that are on our system. And I sent out a practice manager survey a few months ago to work out, well, what is happening with recruitment, what's going to happen going forward. So as a result of COVID, everybody across the board in general practice, and probably, across every sector, saw a massive reduction in recruitment and work opportunities. Now, this impacted in primary care 3 main groups, I think, during the COVID period, particularly. So the first was new GPs that had CCT'd right in the middle or at the beginning of the COVID pandemic. So for those guys, they finished and practices were focused on a COVID response, which meant that they weren't recruiting. They weren't recruiting salarieds or locums. There was a massive reduction in demand of patients. So actually my husband's a partner in a practice, and he was saying, God, it's so quiet. This is amazing. I wish it was like this all the time. So because of that, this group who hadn't had the chance to build relationships with practices, didn't have another income to fall back on because they'd been kind of, employed as a trainee for so many years, kind of really felt that impact. Then the second group are, say, locums like me who have direct relationships with practices. And for me and many people like me, essentially, I noticed a reduction in work, but I was still very much working. My practice managers had contacted me to say, look, this COVID situation's come up, and could you come in a bit early for your session, and we're going to show you like how we're doing video and triage, etc. And I was like, yep, sure. And for those that didn't need me for those additional sessions, they all said, look, when we get busy again, we'll just message you. And I know that I'm not competing with other GPs. I know I'm in control of my work. So I'm actually quite, grateful to have a bit of downtime, to be honest with you. So I think for the second cohort, this locums that have built those direct relationships with their practices, it's probably not, the impact hasn't been as significant. The third group are GPs that you've been reading about. So locum GPs that have been dependent on third parties and agencies for their work. Now, they were hit by a bit of a double whammy, actually. So they had a massive drop in income. A lot of their sessions were cancelled. And actually now, because the market is such that, the demand is less, and these guys are contracted through this agency, so they can't even contact the practice directly. So now not only are they competing with all the other GPs on the books of these agencies and platforms, but they're also then unable to approach the practices they've been working at for some years to say, look, don't worry about this booking fee and charge. I can actually help you out. So they've been really affected. And I think for me and for many, it highlighted the importance of relationships and stability kind of going forward. So what I'd probably say is, so these are the results of the practice manager survey. So all of the practice managers acknowledge demand had increased initially, but now it's getting more and more. Going forwards, we're all going to be delivering a mixed type consultation. So we'll do phone, video, and face-to-face. That's for all of us, whether you're going to locum or be salaried, doesn't matter. That's how we're going to work going forwards. And number 5 is really important. So many practice managers said, do you know what? For the first time in a number of years, I've had like emails from trainees, GPs, locums, everybody directly into my inbox saying, I work locally. So if you have any sessions coming up, or I've just CCT'd, or I'm about to CCT, here's my CV. It'd be great to have a conversation. And they loved it because a lot of them have people going on maternity leave. Partners and salary GPs haven't taken any annual leave for months, so they're going to have to cover those gaps going forward. And the fact that these GPs are kind of being direct and approaching and being very proactive means that these practices are not going to have to go anywhere else to source that support and support that cover. Many also said that for salaried posts, although they weren't advertising on the BMJ and all these other places, on the NHS jobs website, they actually were open to recruiting. It might not be, they can't give you an interview right now, but just email them and start building in that contact. So I think definitely going forward, the future is very rosy, but I think it's moved from a passive, oh, someone will send me a job, I'll just book it on an agency, or just, to actually, no, you've got to be proactive and you've got to protect kind of your income. You've got to, you know, put yourself out there and start getting those direct relationships going forwards. Okay, so the following are questions that Craig and I get from a lot of GPs kind of when they're finishing. So often after years of being told which rotation you're going to do, where you're going to work, now you're told, well, what do you want to do now? And you're like, well, I don't know. I haven't thought for myself in all these years. And now I've got to make a decision. So it can be difficult to know where to start. When it comes to contracts, so that could be when you're working as a locum, so what contract are you agreeing, or as a salaried GP reviewing contracts for the first time. The common question that comes up is, how do I know it's a fair contract? Because you've not had to do it before. So that's kind of what we're going to deal with now. Okay, so actually before we do that, I better talk about this bit about the finding work side of things. So I talked about the importance of being proactive. So going forward for you guys, I think if you're going to be looking for work and you want to be kind of getting access to that work, be it a salary, GP, locum, partner, whatever, just approach practices directly. So NHS Choices have a great Find GP Services website. It's free. You just Google NHS Choices Find GP, and then you put in your postcode or your daughter's nursery or wherever you want to work, and it lists all the practices in that area. And you can just ping them an email or give them a call, and then send the practice manager your contact details. What's important when you're contacting these practices is you say a bit about yourself. So I'm a trainee of this scheme in the local area. Say where you're currently a registrar. I work for Dr. So-and-so at this practice, because all the practice managers know each other. They pretty much all of them have a WhatsApp group. So it's really important to name drop and start building those relationships going forward. But I definitely say NHS Choices I've always found really like a brilliant website, and that's a link for it there. You can also contact the other practices on your VTS. If you're going to be locuming directly for practices, you're going to need a set of T's and C's, and you can download that off the resources section on My Locum Manager. So for locum specifically, the way I've been working to help is all these practices, 7,000 odd practices we've got, in a lot of areas already, you'll get these white boxes on your MLM account where other practices local to where you're working can send you additional sessions and invite you for additional work. Now, these practices are usually people that want someone regular, they want someone local, and often they'll have maternity locums and long-term locums that they want you to fulfill. The other coloured bits are jobs that you would add yourself by having sourced them yourself in whichever way you've done. Oh, and that's just an example of how it appears, and then you can request a book and contact the practice. So yeah, we're currently onboarding all 7,000 to link in with this. So hopefully going forward, it should make it much more easier. Now, I mentioned when you're locuming, if you're locuming directly with a practice, you need some T's and C's in place. You can download a template like this of standard terms and conditions on the resources section of My Locum Manager. But what's important to agree is what your role is going to be in that practice as a locum. So are you going to be doing a fixed session where you see a fixed number of patients, or are you going to be doing an on-call? How many home visits will that on-call involve, and do they need any help with admin, for example? And things like cancellation. What's the follow-up for a significant event? Could they contact you if anything happens so that you can be informed of, you know, of any complaints or any significant event? And also making sure that you turn up for work as a locum with your own equipment. That's really important because you're self-employed, so you shouldn't be turning up to a practice expecting them to supply you everything. Then you fall into the whole IR35 loop. But you can download this and have a look at it and fill it in and send it in. What I would say is the way I've always approached this with practices is I've agreed with the practice manager, like the way, you know, how long are the sessions going to be? Okay, what's your usual rate? Okay, that sounds great. And then I've just said to them for the first new practice, I'll just say, oh, these are my T's and C's. Could you just review them? Let me know if you're happy, or would you like to add anything? I don't say, these are my T's and C's, file them. And I think it's really important that you are flexible and accommodating if you want to build these relationships going forward. Okay, Craig, salaried contracts is a common question, and many GPs will do salaried with a bit of locum or other roles. So, what do people need to ask themselves about kind of reviewing contracts as a salaried GP?
Yeah, I was just going to say two things actually just before moving on to that, which relate to what you just said. One is that one of our previous, so from the live session that we did, one of the delegates on there, she contacted practices directly in the area that she wanted to work, and she was offered a long-term locum role and a salaried role, which they hadn't been publicly advertising. So that advice is good if you needed proof that it was good. And her feedback also was that she was told that they were very impressed with her formality in the letter. So just making sure that you present in a professional way whenever you're doing that as well.
Definitely.
And the other bit also around locum terms and conditions is as Serena says, it's absolutely about building relationships. So do that in collaboration. And remember, there's different types of locum jobs. There's sort of going in, doing a couple of hours, and it's all quite sort of boundaried. There's also longer term locums, which you may wish to negotiate a sessional rate and build in annual leave and sort of almost be sort of on a fixed term salary type contract, which actually may work out better for you. And remember, there are lots of things involve flexibility, so try to be flexible, particularly as it's less of a seller's market now, actually. So it is worth just sort of getting a good reputation for yourself as being someone flexible who is willing to meet practice needs, as opposed to it just being this is what I do and that's it. But I know that you guys wouldn't approach it in that way anyway. So I suppose we're thinking about salaried roles, but also actually this applies to lots of different jobs. Is I think it's really important to sometimes ask ourselves a few questions, verging on slightly on the existentialist, I suppose, not quite as far as why we're here, but I think it is worth doing a little bit of personal reflection as to, what's important to me right now? What's important to me right now, and actually what's likely to be important to me over the course of the next couple of years? Because that helps to frame lots of things in life, but also, what kind of job do I want? Where do I want to be? How much security do I need? Am I thinking about starting a family, imminently? In which case, actually having a regular income or having the benefits of a contracted salaried employment, such as maternity or parental leave or such, may be really beneficial. Or are you willing to just think about exploring, in which case actually working between different practices and finding your feet, or being really flexible but not necessarily having those benefits and that security around you? Or you may wish to work in an environment where you've got more people around you who can support you, particularly if you're just finishing CCT and you're still finding your feet as a GP, which I know I was within the first couple of years of finishing. So it's worth asking yourself a few of those questions, because then it helps to frame your view around the job that you're looking at. So actually, jobs that you're seeing, what does this job offer me as a job? Is this the kind of job that I would like to do? But also, what does it offer me in terms of where I want to go and who I want to be? Is it offering me a development opportunity? Is this going to open doors to do other things and allow me to do other things professionally? And then not just professionally, but also in our wider lives as well. Is this the kind of job that's going to allow you to see your children? Is it the kind of job that's going to give you a good work-life balance? Or to be able to explore other things, such as other hobbies and other things that you may wish to put on your CV to demonstrate other skills. So I suppose then, is it a good fit? Because it's not just about money, and it's not just about the number of patients you see in a session, or whatever those details are. It's actually also about how does it fit in with the life that you want to lead and where you want to go. And then I suppose there's some more specific questions, particularly around salaried GP roles, which is asking the practice if they're a GMS, PMS, or APMS contract holder, which sounds highly irrelevant. And you may wonder why actually you, as a GP, would want to know about that. I suppose these words, these sort of strings of letters that I've just reeled out to you, they are the type of contract that the practice holds with NHS England. And the reason why it matters is because if the practice is on a GMS or PMS contract with NHS England, then they have to offer you the BMA model contract for salaried GPs, or suitable equivalent, or equivalent terms. And if they're an APMS contract holder, then actually they don't have to offer you that. It doesn't necessarily mean that the contract won't be as good, and it doesn't necessarily mean that you won't get the terms and conditions, or that it's not going to be a great place to work. It just means that you know that you won't necessarily be automatically entitled to it, so therefore to keep a really close eye on what it is that you're being offered. The BMA model contract was negotiated by the BMA back in 2004, when the salaried GP was essentially invented with the last sort of major GP contract shift. And it's been iterated since then, and it outlines basic terms and conditions, leave, continuing professional development. We're going to talk about it next. It's a nice contract, and it's continuously changing. So then the question is, are you getting that contract, and how would you know? Which is then the question of fairness comes in, I suppose. So for contracts, which isn't traditionally a really sexy topic, so I apologise for that. And actually, many of us throughout our NHS careers probably have never seen a contract before, or if you did, it often came late. You were already sort of a couple of months into your hospital placement, or maybe even had finished it. And it probably didn't really matter that much at the time. You were on a trainee contract, or you may have been in other roles, and actually the terms and conditions were largely set and probably weren't particularly negotiable, and you were moving on anyway. I would suggest that in post-CCT world, actually that's not true anymore, and that the contract really, really matters. Particularly salaried GP contracts, where you may well be for quite a long time. So it's really important to make sure that you understand the terms and conditions of that work, and that you're happy with them. And ideally, you're doing that before you start your work. There's very rarely things that you sign up to in a long-term basis where you hadn't really agreed what it was that you were going to be doing. So I'd suggest that probably that should carry here. You should definitely have a contract within 2 months of starting work, and bear in mind that if you don't have a contract that's signed, and I think it's after 2 months, then actually it's as if you've got a contract signed. So actually, that's no good, because you don't even know what's in it, and actually your employer doesn't know, and you don't know. In which case, it's a bit that just sounds like a bit of a mess. So if you can avoid that, then that's a good idea. I won't delve too much into the detail of the contract, and the details you can find, and they're pretty clearly laid out within the BMA website. So if you're not a member, then find a friend who is. But a typical contract should outline your job title and the job description, particularly numbers of sessions that you would be working, and the range of days, and also if you'd be expected to do things like extended hours or working on the weekends, or however that practice might do it. It should articulate leave, particularly annual leave, your entitlement to bank holidays, and parental leave. Parental leave being really important, and is one of the really kind of boons of being on a salaried GP contract, particularly with the model contract. It should absolutely outline hours, your pay, your entitlement to pension, which site you're working at, which is getting increasingly important with organisations and super practices that are getting bigger, organisations that work across different boundaries. So you need to know where you'd be expected to work, because some sort of commercial enterprises can have branches all across an entire region. And also your entitlement to CPD. This is continuous professional development, previously known as study leave. And there's the BMA outline how much you're entitled to, and it's based on the pro rata equivalent of the number of sessions you work in a week. Full time, according to the contract, is 9 sessions. It should articulate the contract start and end date. Many contracts will be on places may issue it on like a 1-year rolling contract. Yeah. That's okay. It's important to articulate, particularly if you're expecting it to be a kind of an ongoing job, at what point that will get reviewed. But also bear in mind that if you've been employed in one place for 2 years or more, and it doesn't really matter what kind of contract you're on, you have all the same rights as if you're a permanent member of staff. So once it rolls over twice, it becomes a permanent contract anyway, no matter what it says. Continuity of service is a really important concept. It's about NHS continuity of service, and there are rules around how you accrue it. The 2 things that it primarily impacts on is your entitlement to sick leave, which the sick pay scheme within the NHS and within this model contract is probably the best sick pay scheme, maybe even in the world. But some of your friends who work outside of the in the private sector would love to have a sick pay scheme like this. Essentially, with each year, it increases up to a maximum of 5 years or more of 6 months whole pay and 6 months half pay, and that's pretty good going. But you need to have accrued that continuity of service, so it's worth ensuring that you haven't inadvertently broken it. And the other thing it also impacts on is your entitlement to parental leave, which for a lot of people is one of the reasons why they may move from locuming to salaried. And I've had a friend who has been pregnant twice, and both times she missed out on maternity leave because of nuances in her contract that meant that her continuity of service just wasn't recognised. Total disaster. So please don't repeat that. She wouldn't want you to do that, and that's why she doesn't mind me telling you that story, I hope. And so just bear that in mind. The rules on how to maintain your continuity of service are within the BMA. Key things to note is that if you locum for prolonged periods of time, that actually you will break your continuity of service. So if you locum for more than, it seems to be that if you locum for more than a year, for more than 12 months, then you can break your continuity of service because you're technically self-employed and not employed by the NHS. If you take breaks of 3 months or more, where you're not employed by the NHS for that period of time, you'll break it. But you are allowed 12 months of career break in as long as it's part of a formal scheme. 12 months of working abroad as long as it's part of a formal scheme. So just check and just make sure. And you're also allowed, the other thing that's also really key, I suppose, is if you have an honorary contract, which is particularly relevant for colleagues who'll be in academic or doing a PhD or something similar to that, then that counts as well for up to 12 months. But just bear in mind and check the rules. And then the other thing that's also really important about contracts is that actually, while everything's hunky-dory, it's fine. The real thing about contracts and having these kind of documents is what might go wrong. And we hope it doesn't, but your contract should outline what happens if things don't go so well, such as grievance and termination, which
so you should know what your notice period is as well.
Absolutely.
That's important. Okay, let's go through. Okay, so you've covered most of these points. Do you want to summarize?
Yeah, so I generally ask with these things, who's confident with negotiation? And actually the minority of people say that they are. And a lot of things that people say is that they think, oh, I don't know, because we're all very British about it, aren't we? It's like, oh, I don't know if we should, oh, I don't know, is kind of what I'm given. I'm not sure if I'm happy. I shouldn't really complain. And actually negotiation isn't complaining. Negotiation is an expected part of business. This is business essentially, isn't it? And also I think we've also got this image of negotiation being like on The Apprentice, where kind of like you aggressively haggle for 50p off something and then shake everyone's hands, and it's all a bit weird. And that's not really right either. It is, though, part of a relationship building process. And it is important. And actually, as GPs, you guys negotiate all the time. Patients come in saying, doctor, I need antibiotics. Doctor, I need a CT scan of my finger that I stubbed yesterday. And what do? We say, oh, I don't know. Let's talk about it. Let me understand. Let's see where you get. And you try and meet in the middle somewhere. Yeah. That's what negotiation is. And you can do that. And you guys are experts at that. But I've got some top tips for you, which should hopefully help to set the tone and so that you approach it in a way that hopefully will give to a successful outcome. One is just be realistic. We see these people on TV programs, on like the house buying programs where they want everything and they don't have much budget and it's all just completely unrealistic and they never find a house and it's a bit of a disaster. Bear in mind just what actually might be real. Having an entirely bespoke working pattern that is completely out of keeping with the norms of the profession is probably unrealistic, although maybe not impossible. But just think about, well, actually, what's possible here and what's likely. And if you do that and you think about what it is you'd like to do and relate earlier on to what's important to you, kind of draw up, I suppose, a list of things that you really can't compromise on. If you really, really, really need to be somewhere on a Tuesday, that's somewhere else. Well, then you can't work on a Tuesday. And if they insist you need to work on a Tuesday, then maybe that's not going to work out. But there's other things that you may wish to compromise on, such as doing the occasional Saturday, or I don't know, whatever it is. But just have a think about what it might be. And be really honest, both with yourself and with your employer. If there's something which you really can't do, such as working on a Tuesday, then there's no point in saying that you can, and then when you get the job saying that you can't. That's a really bad way of starting a relationship. And also, you hopefully would expect your employer to do the same thing.
Yeah, and I'd also say that there's no harm in asking. So I can say from my point of view, for example, when I went back, I had my maternity leave and then I went back to work. And for me, it was really important that I only had a certain number of times in the day where I could work because of children's nap times, feed times, and all the rest of it. And I just asked the practice manager, I said, would you mind, because, she was like, oh, we need you for these sessions. And I just said, oh, look, would you mind if I did 9 till 12 because I've got to get back and and she was like, yeah, that's fine. So actually just asking and explaining why is quite a nice way. And it might be, say, for example, if you're returning back after maternity leave, you might have slight restrictions in the days you can do and the times you can do whilst your child gets used to nursery, etc. Now with video and telephone consulting and everything else, you might be able to do more sessions from home. But it's just worth asking the practice, like, these are my challenges. How could we work together so it's win-win for both, you know? And I think that's really important, that it's a conversation. It's not like a hardcore apprentice style kind of battle, I'd say.
Absolutely. Can we go back to that slide? Because hadn't. Yeah, there's a few other bits that link to that, and I think that it's absolutely worth asking. If you don't ask, then you don't get, and the employer may also ask, and that's fine. Just a few key points just to bear in mind around that is that there are hard limits. So your employer may well actually just can only they need certain things. They really need a Friday, and that's just how it is. They really need someone who's a trainer. You know, there are some things which they may just feel they can't do, and they'll have sort of deal breaker things that they can't meet as well. And also bear in mind that other staff work there already. You're not supposed to, in fact, legally, you're not supposed to pay two people doing the same job two different rates. And because we had that with sort of the gender pay gap and such. So just bear in mind that actually, if you're asking for expecting a much higher pay rate and it turns out everyone else has a much lower pay rate, that probably isn't going to work. And also bear in mind that people talk. So you get into the environment, and actually if people will find out that you're getting paid more, or even you might be getting paid a lot less than everyone else. And actually that's a really bad thing for your employer. So everyone should be keen to avoid that. Bear in mind also that it's not just about money, and that there's all sorts of other factors of reasons why you may wish to work somewhere, because you enjoy the team, you enjoy the people. It's a good step up into the kind of thing that you want to get experience in. And part of this is also about then, if the match is pretty good, then the kind of things that you're asking for, such as the, flexibility on sessions or job roles or wishing to develop yourself in some way, actually, if the match is pretty good, then you might find the flexibility is more. So just think about what it is that you really want and how well does this match. And also, if it doesn't match, then there's no point in sort of pushing it and trying to make it fit when it doesn't fit.
Find your match. It's just a question of maybe going through a few different opportunities before you do. So I think that's important. Okay.
So these are very briefly a few sources of support. I think if you're ever going to be a member of the BMA for anything, it's to get your contract checked. They've got a contract checking service. I've got colleagues, and I've heard lots of stories about how this contract checking service has meant that some people just haven't taken a job, and they've managed to dodge a really poor contract. But they've also managed to highlight sort of changes that aren't quite right. Bear in mind also that your employer may not be HR specialists themselves already. So it's not about people are trying to catch you out. It may also be that the contract has changed, the contract they're using hasn't been updated, or that actually there's just some things that have just got mismatched. So it's a really useful service. Typically, joining the BMA can be free between August and September, so it may well be worth joining, and then if you don't want to continue, leaving. But also don't forget that the BMA, whatever we might think of them in some contexts, they are our trade union. So just bear in mind that actually they're really helpful there if things don't go quite right or you need extra support. So do bear in mind that a membership there might be helpful.
Okay, great. Okay, so this is just to summarize kind of before we wrap up. So I'm going to do the locum bit and Craig's going to do the salaried part. But I'd say things to think about as a locum is currently, if you're going to locum, and you might do salaried work with locum on top, you might do full-time locum, whatever you want to do as a flexible kind of career, just start contacting those practices directly. If you're going to finish in a few months, start doing it now. Get your CV out there, start building those connections. If you don't get an avalanche of responses, that's okay. You can follow them up in a couple of weeks or a month's time, but definitely start building that relationship. And don't forget, there's also extended access, urgent care. There's lots of different pools alongside the practice pool. So start connecting in your area. You can download the terms and conditions template off the My Locum Manager resources section, have a look at that, and then pass that on to your practice manager. Think about competition. So with agencies and where they're promising you, oh, we're going to give you all these types of jobs. If you're not going direct, you're going to be competing with everybody else. So I think one thing a lot of locum GPs have learned in the COVID process is the importance of having that direct relationship and avoiding that. Employment restrictions. Do you remember what I meant by that, Craig? I can't remember.
Yeah, you meant about agencies.
That's right. So with agencies, you will not be able to work directly for practices that you've worked through for an agency for a certain amount of time. And so just be aware of those things, I think, going forward. Obviously, when it's new to you, it just feels quite daunting. And I'm going to share a really good booklet that I've written that can take you through that step by step in the next slide.
And I suppose from the salary GP point of view, it's just I think whilst none of us can be contract experts and we shouldn't be expected to be, I think it's just about knowing the right kind of questions to ask. If you have a sense of what should be in a contract, then you can give it an eyeball and see if it looks right. Also knowing whether or not you are entitled to the BMA model contract.
Yeah.
And if it's not the BMA model contract, then absolutely get it checked or ask some questions. And then I suppose also just remember that you can change your mind. All of this is around, you're not committing to a job forever. It's actually, and if a job isn't working out, well, then there are the terms and conditions in your contract will identify how it is that you can leave if you need to. But I would encourage you to talk to your employer if you're in that position, and just make sure that if you are entitled to the BMA model contract, that you're getting terms and conditions that are aligned with that.
Great, thank you, Craig. A little bit about pay.
Yeah, very briefly. So we get asked about pay a lot. Unlike in trainee land and in hospital land, where you're on set pay scales and increments, there isn't the equivalent of that in general practice. The pay is set by the practice that you work for, but it's also set by the norms and the general kind of levels that are the going rate. There's a national guidance which says that kind of for a full-time equivalence, that's 9 sessions, that they recommend somewhere between 55 and 85 grand, which equates to about 6.5 to sort of 8.5, 6.5 to about nine a session, something like that, 9.5 a session. The reality is, if you're being offered 6.5 a session, you're probably underselling yourself, unless it's a great job you really, really want and offers you something. And probably the going rate is somewhere around 9 a session, 9.95. But it really depends on the job. It depends on the role. It depends on how much you want that job and if it's a nice place to work. And no job is the same. So there's no. We always get asked a lot about, well, how many patients should we see in a session? What should that be? My answer to this always depends. It depends on the patient base. It depends on how the systems around you work. It depends on the pattern. It depends on what everyone else is doing. It all depends. And try to think about salary jobs as a package as opposed to individual sessions. So the other typical question we got asked in the live webinar was around, duty doctor sessions, which may well end up being slightly longer just because you fill in a bit of time. Actually, it depends on it as a package. Actually, what else are you expected to do? What's the rest of the week like? Actually, is it a good job as a package? Are you happy? Does it work for you? So try not to be too sort of rigid, I suppose, in terms of thinking about it.
Okay, a little bit about locum pay. So every area is different in terms of what they offer, and there is no fixed rate actually. So in my area, it's about 85 an hour plus pension on top. So when you're talking about pay with a practice, the way I've always done it, and I know most GPs do it, they'll email the practice will, yep, we do need some sessions, or if you're on MLM, they'll send you the sessions through. And then you would normally say, well, what's your usual rate? And then they will say it's X amount an hour. And your then question is that including pension or with pension on top? And you agree somewhere in the middle. I'd say kind of below 70, 75 or 70 below would be a bit unusual to have that kind of rate, to be honest with you. But it varies on the area, it varies on the practice. And what you probably also want to know is, what are you getting paid for? Are you going to be there the whole day or half a day? Are you doing an on-call for them, which means you're going to be there seeing some patients, doing some admin and some bloods? Or are they saying, no, we just need you for 2 or 3 hours just to see patients and then you can go? So that's where you say, what do you need me for? What would you like me to help out with? And then they'll tell you. And I'm going to mention the guide shortly, which you can download.
And Serena, on that, I suppose it's worth saying that there's different types of pay. So there is hourly pay. There's also, you may wish to agree a sessional rate. Bear in mind also that one of the reasons why locum pay is much higher than salary GP pay, it's the other question we often get asked, is because you don't get any of the benefits. There's no holiday pay, there's no sickness.
Yeah.
And actually, we saw that with the COVID crisis, is that actually when the work dried up, well, actually there was no as a locum, that was part of the hit that you took, was that actually if the work wasn't there, then you couldn't work. You didn't have the benefits around you.
That's an important point. So as a locum, so what I do is I have my buffer, so I have my savings, which, you know, if I'm not working as much, I can dig into, and I have my tax account, and then I have my regular money coming through. So you do need to know how to manage that, and that's essentially what my locum manager helps you do. It creates all your invoices, does your tax, puts you with, you know, links you with really good accountants, and gives you lots of support as well. Because I think actually I more see locum work, rather than being locum, as more flexible working. So you could be a salary GP and a partner and be working flexibly on the side. You could be a pure locum working flexibly and doing other things. I think the term locum per se is probably going to move into this more flexible working category. So the other thing I'm really passionate about is delivering webinars like this, because of support. And all of us, especially within our first 5 and post CCT, need that support. So the kind of support you get with MLM is we're partnered with Headspace, help support your emotional well-being, so you get a discount off them. We link you in with really good accountants. So I'd be very worried if you're just talking to an accountant and saying, I'm going to locum, and they say to you, okay, set up as a limited company, because that should not be their response. They should be mapping out what your aims are for the next few years and really taking into account, is it worth you forgoing your pension? We work with GP Update a lot, and we've created this Locum Essentials guide, which covers sepsis guidance, emergency drugs, just safe ways of working, particularly if you're working in different practices. And you can download that off the Redwell website for free. And we have our own locum guide, which covers all the things that Craig and I have been talking about in the slide deck. And you can download that on the resources section of My Locum Manager. And that's a screenshot of the resources section where you can get access to all those things. Okay, great. So yeah, that's a link of the resources. So we really hope you found this useful. We're going to be doing lots of regular webinars, and Craig, you promised you're going to come on and do some more for me, haven't you?
If you'll have me.
I will, definitely. So thanks very much for joining in and watching this recording. Share it with your colleagues, anyone else that might find it helpful, and you can always ping us some questions if you're feeling a bit out of sorts and you still need some further help.
Absolutely. Take care, everyone.